All right, so there is a lot of hyperbole and a lot of clickbaity stuff. In fact, individuals I hold in high regard and respect, Tim Pool, you have quite a clickbaity title on your video. In fact, Tim Pool's title says coronavirus could infect 60% of the world population, expert warns. This is getting serious. And then in his video, right away, he goes into an article that says basically what his title says. And then he says, in it, the very first few sentences are, but there are basically too many factors, so that's a little bit hyperbolic. And he says, well, why didn't you lead with that? Well, Tim, why is your title clickbaity? And I'm just seeing it all over the place, all the articles and everything, they're really clickbaity. And I got you, we're human beings, we all want clicks, you want the money, you want the ad revenue, you want the clicks, I got you. But let's get into it and really kind of see what is going on. Could the new coronavirus really kill 50 million people worldwide? Not likely. Not likely. First off, the virus, if it kills people too fast, it's going to die out very fast because viruses with a high mortality rate, well, they aren't very successful because they can't propagate. Viruses are like human beings. They want to propagate. What's the meaning of life? The meaning of life for every form of life is to propagate. And as a virus dies off, they'll either mutate and become less deadly or it will die off. If the spread of the new coronavirus isn't halted, it could infect 60% of the world's population and kill 1 in 100 of those infected, around 50 million people. At least that's what Gabriel Leung, chair of public health medicine at Hong Kong University, told The Guardian on February 11th. So globally, are we able to stop it globally? Basically, there's 40,000 cases in mainland China. 24 other countries are reporting around 300 cases. The virus is definitely spreading a lot quicker than they had anticipated. People are infected, generally show symptoms within 3 days, but it's been as long as 24 days. The problem with that is the quarantine time is 2 weeks. That's what the average quarantine time for this coronavirus is. Well, that's 2 weeks too shy. We've got to do 30 days because what if you release somebody and then 2 weeks later, because of they're one of the rare individuals who has a 24-day period before showing symptoms? What if? What if? What if? But an artificial intelligence program had predicted that the coronavirus would infect 2.5 billion and kill 53 million of those. Now, the guy that had started the program has said that it is pretty accurate as of to date. He's forecasted, and it's been within 3% of what the very next day's publicly released numbers are. However, as time goes on, those numbers, I would expect, percentage-wise, would rise, as in, like, how far off the AI's prediction is, because there are too many factors. So let's read this one. Rational or not, fear of coronavirus has spread around the world. Facebook friends in Nevada are buying gas masks. Surgical quality masks are selling out in Vancouver, Canada, where many Chinese have recently immigrated. United and other airlines have canceled flights to China, and a cruise ship with thousands of passengers is quarantined off the coast of Italy after medical professionals discovered one infected passenger. A new site that tracks coronavirus infections globally says we are currently at 24,566 infected, 493 dead, and 916 recovered. All this prompted James Ross, co-founder of fintech startup Hedge Chatter, to build a model for estimating the total global reach of coronavirus. So he basically started with the day-to-day growth. He used a recurrent neural network, plugged in the numbers, ran it 10 million times, had the next day's data for that, plugged it back, the next day's data back into the machine, and reran it 10 million times. So the results, according to him, have been stark and startling. Horrific even, they say. From 50,000 infections and 1,000 deaths after a week to 208,000 infections and almost 4,400 deaths after 2 weeks. The numbers keep growing as each infected person infects another in turn. In 30 days, the model says 2 million could die, and in just 15 more days, the death toll skyrockets. But there's good news. The model doesn't know every factor which Ross knows. And multiple doctors and medical professionals say the good news is that the conditions and data fed into the neural network are changing. As those conditions change, the results will change massively. It's the same effect as if you have distance and you change one little thing. So you have a meteor going through space and it's headed towards Earth. And it is, I don't know, 25 million light years away. For some reason, we have technology to sense it out there. Just roll with it. It's headed towards Earth. We know it's going to head towards Earth. We know for a fact it's going to smack dead Earth right in the middle of, pick your favorite city. So how do we change it? Well, all we have to do is change it by its direction by a millimeter, by a little millimeter. That 1 millimeter times the distance is going to change the course of it drastically. Every tiny little bit of new information that goes into this model is going to change the information drastically. One important change, the mortality rate. If a high proportion of infected persons are asymptomatic or developed only mild symptoms, these patients may not be reported on, and the actual number of persons infected would be much higher than reported, says Professor Aya Leshem at Sheba Medical Center in Israel. This may also mean that the mortality rate, current estimated at 2% of infected persons, may be much lower, because there's people running out there that are infected that don't have bad infections that are getting better. And they're not counted as being infected. So here you have an incident where the number of infected is actually much higher than what China's reported. But a lot of them aren't actually being reported because their symptoms aren't bad enough and they recover. So that would make the mortality rate much lower. Your infected rate goes up, which makes the percentage of mortality rate lower. We just don't know because, well, if their symptoms aren't bad enough to be reported, well, you can't report them, can you? Wider infection doesn't sound like good news, but if it means that the death rate is only 0.5% or even 0.1%, coronavirus is all of a sudden a much less significant problem. Also, now that the alarm has gone out, behavior changes. It's exactly the same thing. So, yes, the AI is going basically on this information, but as information changes, the AI's information changes as well. So don't go bury your head in the sand, obviously. Stay informed, but don't go on these clickbaity sites and propagate clickbaity stuff. Hyperbole. The death rate is falling as we understand that the majority of cases are not severe, and once testing is done on larger groups of the population, not just hospitalized patients, we will see that the breadth of the illness argues against this being a severe pandemic. So basically, what we're going by are the numbers in hospitalizations. There are going to be an unknown number of people, but it will be a large amount of people who are in their home. They've been a little bit sick, but then they have recovered, and it's going to be the coronavirus that got them a little bit sick, but then they recovered. Once we add those numbers into the total number of people infected, that's going to bring down the mortality rate or the percentage of death rate due to the coronavirus. It makes perfect sense. So yeah, I mean, times are changing, information is changing, and I will, as of course, try to bring you up on information as quickly and as accurately as possible without being hyperbolic, Tim. I love you, man, but that was not cool. Especially since you called the article out in your story for being hyperbolic, and yet your title is hyperbolic. Just, come on. Don't feed into the panic. Just don't do it. Yes, be aware. Is it possible? Yes, obviously it is possible to a very small degree. Anyways, that's what I got on this one. I will see you guys on the next one. I thank you so much for your precious time, and you guys have a good one.